Hello, everybody. This is Dr. Kashif Abdullah. It is uh, April 3rd, 2020. It's a Friday. Um, and we are about maybe 2, 3 weeks now I haven't started really counting, or I've lost track of the COVID-19 situation. I'm here to answer any questions people have. If you want, you can ask questions on the live chat, or you can direct message me. I'll just say hello here. There we go. And if you have any questions or anything I can answer, I'm willing to answer any of your questions. So let's see. I wanted to speak to you today about what is the number of cases. So today we have, oh, actually, let me switch screens here. Sorry, I forgot. There we go. So if you look here, we have approximately 1,076,000 cases as of today. And if we look at the daily increase, we can see that we have not yet dropped. We're still either increasing or hopefully plateauing. We keep saying that about the plateauing, hopefully, but we're just looking. If we look at the total number, and this is more, of course, than yesterday, about I think maybe 76,000 cases more. So it's it's hopefully slowing down, but we need more data to tell if it's slowing down in the world. But we have now confirmed cases of 1,776,000 cases. And let's see, in the US alone, we have 261,000. That's up from yesterday. I think yesterday was 230 something. Yeah, something like that. So another 30 plus some odd thousand cases today than from yesterday. And we are, if you combine both Italy and Spain, we are the US is larger than both countries combined. Of course, the population of the US is much larger than both Italy and Spain. I know Italy's around 60 million. I don't know Spain's population. I would guess also 60 to 70 million. So the US is at least double the size at the very least. So the U.S. has, the epicenter of the U.S. deaths is still, unfortunately, New York. It's unfortunate anywhere if it is in the U.S. or anywhere in the world. But we're at 1,562 deaths in New York State city alone, just the city, not the state. If we look at the daily number of increases, we can see that we're still increasing in the U.S. We don't know where this is. We don't know if there's more to go, or if this is plateauing. We're just watching the numbers and trying to do social distancing to avoid further spread of this virus. Italy, we see about 119,000. The good news for Italy is they likely have gone through the peak of their increases in cases. So the number of cases are beginning to diminish as the days go by. So Italy, I think, is gone through the worst of it, and hopefully the number of new cases will fall more and more every single day, whereas it'll be just kind of the point where people are just hopefully recovering from this disease. Spain, I think it's similar, hopefully. This may be just a plateau, but we haven't really seen a good drop in Spain like Italy, if you look here. So, and Germany was looking good, but is increasing again, and they're likely again in the plateau stage. And I do want to mention this, or preface this, that the number of that we would expect, actually the highest number of cases actually in this week. That's what most health experts were expecting. Actually, we're expecting that this would be the worst week of them all. So far, it's not that bad. It's not increasing more and more. Hopefully, after this week and the week after, we'll have decreased significantly. Let's see if there is any questions. No, still no questions right now. Okay. And is there any questions on this thing? I'm looking. No questions right now. Okay. I'll continue. So France, if you look at France, same thing. They're beginning to diminish. So actually, they're diminishing after 2 3 days. They've been diminishing a lot, and so ironically, Iran is also plateauing, which is good. The United Kingdom, we're still increasing, unfortunately. And Turkey, still, and Switzerland, better. Belgium, it's a little bit better, but we'll see. Netherlands, and then Canada is also. That was a bad day. It looks like. When was this? This was the April the 1st. That was 2 days ago. That was a really bad day of in number of increases. I was hoping that this would be slowing down, but like I said, I was expecting, and most health experts were expecting this to be the worst week. So hopefully, after this week, things will get much better. Hopefully, and then Austria, I think, is actually doing really well, if I'm not mistaken. Yeah, Austria is doing really nicely. They're really doing what should be done. Them and the North and the South Koreans are doing really well. I would say the South Koreans are the best. I don't know what's happening in North Korea. No, there's no data. So it looks like we're still in the thick of this. And I've been recently reading news about the issue of face masks. And previously, the recommendation has been, if you're not sick, you don't need a face mask, and you can get by with just social distancing. And the face masks are only there for the very sick people or health practitioners who see a multitude of sick people over the course of a day or the last couple of weeks. Now, the there are new recommendations. If you look here, this is from Berkeley, and they're recommending covering the spread. So, and it's not just Berkeley; it's other parts of the United States that are beginning to suggest to cover your face with a mask, or to suggesting now using masks all the time. So, this is a new thing I'm beginning to hear on the news, and I think this is only because, more than anything else, is because um, these the counties and states in the United States are desperately trying to control this. I don't know if this is an I don't know if in Canada or in the rest of the world this is becoming more and more prevalent to recommend using face masks. And here they're not really saying face masks. What if you look at it, really what they're saying is using some kind of barrier or face cover to limit. So they're recommending just bandanas. I've read that somewhere a little bit lower. Yeah, wear a bandana to protect others from infections that you might have, which we already know. And when seeing wearing cloth, know that they're protecting you. So there's now, I think what they're trying to recommend is in Berkeley here, they're just covering your face somehow, so that maybe someone who's potentially sick doesn't give it to others. And let's see. Oh, there's a question. Let's see. I have a question. I have Crohn's, and I take Humira. How bad is my system at this point? I'm in the late 20s and normal health. Well, it's not really, you know. Okay, so in regards to Crohn's disease and Humira, um, I would say that you when you take anti medication like Humira, yeah, it will suppress the immune system so that you don't have an inflammatory response to this problem. Now, um, I would say your immune system is the same as it always has been. It's not as how bad has it been? How bad is my immune system at this point? It's the same. So, in your normal health, that's good. I would say for yourself that you should stay indoors as much as you can. You should try to avoid anyone who coughs. You need to be as you need to try to protect yourself as much as you can. Now, technically, this is where okay. So what I'm trying to there's one thing. Maybe the Humira is sort of helping you in one way. I don't have enough. I have to really look into data into this. But one of the things with ARDS, so what happens is COVID-19 hits, it gets an infection, there's a long incubation stage, which is why now people are now in Berkeley is beginning to recommend just wearing some kind of face covering, not a mask necessarily, not a medical surgical mask or a N95 mask, but some kind of covering so that you don't spread germs. I think they're trying to bolster or improve the social distancing. But when someone has COVID-19, they have fevers, they can have colds, and they can have shortness of breath. But what really starts happening is they slip, some, especially the elderly, slip into ARDS, acute respiratory distress syndrome. And that's when the immune system is just going haywire. Now, technically in that case, we actually give steroid and we're actually suppressing the immune system to not make it bad. So I don't have data on this, and I would have to really look into this. But maybe Humira might actually help you, meaning your immune system might not go overboard. I don't have enough information about that. I don't know. I honestly, it's like me as a doctor, I don't know. I would say this, like I said, to answer your question, um, your immune system has been the same as it always has been, and I would say you should try to. You may catch it more easier than others. Yes, with Humira you may catch it easier, but maybe your immune system might not go into overdrive like other people with regular immune systems. So it's sort of like an up and down kind of thing. But I would say in general, you have a higher likelihood of catching this. So I would say you should avoid anyone who is sick. You should try to keep social distancing as much as you can. Stay safe. If maybe for you, maybe a mask is the best thing to do. And if you're in normal health right now, that's great. Just keep it up. Don't endanger yourself. Don't go somewhere where you might hurt yourself. But yeah, thank you for the question. If anyone has any more questions, feel free to please ask those questions. So let's see. And let me 1 second. Let me jump to this thing right here. So what I wanted to just, one of the biggest things is I have to reiterate this, that we need to keep social distancing. And keeping social distancing is important because it helps us create herd immunity. Um, and it's not easy. This is a very stressful time. As the days and weeks have gone by, COVID-19 is becoming more and more stressful, and it's not easy. And I totally understand that. And there's actually a lot of um emotional stress that's occurring, and that needs to also be addressed by health practitioners. Um, Let me switch here for a second again. Um, there we go. And let me just peruse any while I'm waiting for questions. If there's any more questions, no. Um, Let me see if you have other questions. Oh, thank you for the like. I saw that. Thanks. Yay. Okay. Let me see what else we have here about the news. Maybe I can speak about that. Um, I sort of now know how hard it is for radio talk show hosts. They have these topics. So let's see. These are unfortunate things that are happening in Ecuador. Ski destination, highest destination. Oh, don't go skiing, for goodness sakes. Don't think that you can go outdoors. Um, let's see. Um, let's see. Governor Waltz. Let's see. Um, Someone is celebrating 104 years of age. That's very good. Um, and let me, if there's any new news here about this. Um, I'm also myself taking, this is recently, looks like today from USA Today, and they're just talking about job losses, which is a huge kind of, huge thing that is happening in our nation and around the world. And that can cause a lot of anxiety, the job losses, um, where, it's saying here the United States just looks like someone about over 700,000 jobs were lost. That's very, very sad. This is just affecting not just health and people's health, but it's also affecting people's job losses or jobs, and that's not easy. Um, let's see. Is it just ads or something like that? Let's see. What else do we have? Um, let's see. Latest news, updates. Let me see if there's any questions on the WhatsApp that. Um, okay, let's see. Oh, let's see. What else do we have? Um, let's see. The same question about self quarantine. I'm just looking at old messages and what people had asked before. Um, let's see. Just about. Oh, there was something of a. There was a question about. I saw this one article, or someone posted one article about um, how long the incubation period is. So let me jump here 1 second. Yoink. So, in regards to the incubation period, um, it takes about 95. One of the questions was, or was trying to determine of how long is the incubation period in COVID-19. So, if you get exposed, how long is it important to try to see if you have the symptoms? So, there was a study that tried to emulate. Let's see, this one. How many people were in this study? I think there were about only 485 some odd people in this study that determined how long is the incubation period. So one thing about study design is you have to realize that data that we take when you take 500 some, this is part of, when you take like 400 or 500 some odd people and you try to extrapolate it to the rest of a population, it's not always easy. So and it's a model. A model is not going to like exactly depict what's going to happen. So this model of 500 some odd people showed that in 5 days, 95% of the cases that were positive for COVID-19. So what they did is they found like 500 people that were COVID-19, and then they tried to, from those people who were COVID-19, they asked, so I believe, no, it was 500 people, and those 500 people were had showed symptoms, okay, and they're obviously and then they were tested positive for COVID-19. Then they took those 500 people and they asked them, how long did it take you to get the symptoms? And 95% of those 500 people essentially said that we had in about 5 days. And then like 99% of those people of that study, of that population, said that we had like 11 or so days. And so that's where the 14-day recommendation, I may have been this study specifically, where they only took 500. So someone asked me about what are the subtle nuances, and what I was trying to say to them was this subtle nuance is you cannot exactly take a model and say this is what's going to happen in real life. It's sort of like it's basically so it is a theory basically, and so you can always add more variables, more issues. Maybe your model is not correct, but in general, what we found is, of course, 14 days is it. But you can't say that, oh, this 95% of the people are in this 95% of the people in this model show they had symptoms in 5 days, so I should only wait 5 days. No, technically you should wait beyond the 99th percentile was 11 days, and then 14 days that sort of covers for that model. So things may change about the model, but let's see. That was a little bit of epidemiology there, a little bit. Let's see what else. I'm just looking at people's messages here. Let's see. Some people are having other symptoms. The primary symptom, and there were some questions about wet stools or diarrhea, or not being able to hear properly, or more not being able to taste. Not hear, sorry. Not able to taste or smell. That was a new symptom. So in regards to the primary symptoms, is still fever, cough, shortness of breath, which is that's a shortness of breath, and the what's it called again? Outside of the shortness of breath, the inability to smell or taste. That is more like that's a new symptom, maybe. that can we possibly use to differentiate if there's no COVID-19 or not. But that's not like been definitively put in. But many ENTs are saying that yes, that should be a symptom we include to help further differentiate COVID-19 from non-COVID-19. Um, on a side note, I had another note is I wanted to mention that I myself have been getting messages from like labs that are now beginning to say that they can test for COVID-19. So your primary can or can have COVID-19 testing results. You don't might not have to just go to the ER or the public health department. So those testing kits are now beginning to become available for primaries, and you can use your insurance. So what I like to let you know is, if you're having symptoms, or your doctor, or you've already contacted your doctor, you should contact them again and keep them apprised of your symptoms. You can just call once a day, saying, "Oh, I have these symptoms and those symptoms," and treat them accordingly. But let's see. But I'm just saying that we're getting better and better at testing, and hopefully, like I said, this will start to go away on its own. Let's see what else. So I'm just looking at more of the website if there's anything. Yeah, I can. Let me share my screen. Let's see. Hold on. 1 second. Is there any other question? No, not any question, but I can share my screen here. There we go. There I am. And then again, this is a great website right here to use, the Johns Hopkins coronavirus website. This is basically the main one most people are using. You can refresh and see the 1,083,000 some odd cases in the world, and the epicenter is the United States, and more specifically New York City, and how New York City is dealing with this issue, and they're the ones that are going through various hardships. Let's see, and then is there anything here? No. Well, okay. Well, let me go back here. Hold on. There we go. Well, there we go. Well, we're coming to the close of at 1 o'clock. You know, this will be basically, I think, the third week now of this coronavirus COVID-19 issue, and it's just a matter of time that we get over this. I'm hopeful that things improve, and if you have any questions, please feel free. I want to make this as best I have this channel grow, and if you like what you hear, you can always subscribe, or you can like the videos. I feel like a YouTube guy now, but I'll just keep doing these during this hard time. I know it's really hard. You can always look back at some of the videos and watch them, how things are going. I appreciate all the time that everyone, hey, 2 viewers is better than 0 viewers, or 1 viewer is better than 0 viewers for me. So if I can even help one person, that's great. I'm willing to talk to all you guys out there. And it just day by day, we'll get through this. The whole world will get through this. And thank you again. And I'll see you guys Monday. That's when we'll be back. All right. Monday at 12:30. And yeah, thank you again. Bye-bye.